How's it going?
Doing all right.
My name's Christian. I'm a student physical therapist. You're happy to be working with you today?
Yes. I'm
Awesome.
totally
So what's going on?
I'm just having some pain in my back. Sometimes my chest too, and it's just kind of tight. It's happened. It didn't really hurt during the accident, but it just kind of gradually came on the past 3 days.
What do you think the accident that caused this was?
So what I think happened was I was watching my kids on the trampoline, and one had slipped off, and I luckily was there to catch them, and I caught them and was twisting like this, and I just picked them up and put them back on. I noticed that I was just kind of bending up my back. I didn't use my legs because it was just a sudden reaction, and like I said, it didn't hurt at the time, but that night and later the next few days, it just started to hurt.
This was about 3 days ago. You said it's been hurting?
Yep.
Okay. How's taking a deep breath? Anything with that hurting or?
Yeah, if I'm just breathing normal, it doesn't hurt too bad, but it's when I take like deep breaths, if I'm climbing stairs or something, I get a little winded. That's when it really hurts, when I deep breath in.
Okay. Are you able to point to where the pain is?
It's just kind of like right in my back, up here.
Okay.
Not really lower back or anything, just kind of up here. And like I said, sometimes in my chest, and it's more tightness and a dull ache.
Okay. So you didn't feel that sharp pain initially when it happened?
No sharp pain.
Have you been having any numbness and tingling on your legs or your arms or anything like that?
Nope, just that dull, achy pain.
Got you. All right, well, we'll do a little quick screen on you. Couple more questions. I noticed that you said you haven't had any GI issues, and then you just wanted to come in, get it checked out and all that. So
yep, no stomach issues.
Okay, awesome. So the first test I'll kind of have you do is going to see some range of motion.
Okay.
So can I get you to just look to your left? Okay, can I have you look to your right?
Yeah, that causes some pain.
That's starting right there?
Yep.
Okay, can I have you look up? Back down?
That causes a little bit
This
too,
little sore
over
as well?
on this side, yeah.
Right here?
Mhm.
Okay. Is this tender at all in this area?
On that right side. Left side's not bad, but the right side I can feel it.
Okay. All right, so can you look to the right again for me?
Yep.
Seeing your range, that's where it's starting to hurt?
Yep.
Okay. I'm not gonna put any more pressure because I don't want to cause any more issues with overpressure.
Okay.
I'll have you look straight.
Okay.
All right, now I'm gonna have you look to the right and then turn your body when you do it as well. Now,
Yeah, right
there?
Yep.
That's sore? Okay,
Yeah.
how about the other side?
Nope, no pain there.
Getting a lot more range of motion there, you
Yeah.
can tell. All right, I'm gonna have you bend down like nice and around my chest. Right, your chest around my head.
Yeah, that causes some pain.
Okay, and right behind you.
That actually doesn't hurt.
Okay, that's good. All right, I'm gonna have you bend down on this side now. Come like around my arm.
That feels all right too.
All right, now this side.
Yeah, that hurts.
Okay. All right, I'm not gonna apply any overpressure either, just because we're getting a little limited range of motion and you're getting in some pain, so we want to avoid that.
Okay.
Can I have you stick your arms up over your head as high as you can?
Oh, that kind of hurts on that right side. The left side doesn't hurt, but that right side hurts a little bit.
Okay. All right, I'm not gonna put too much overpressure with that either. So what I'm noticing is that you're having some pain with your right rotation, and that being with your neck and you're a little limited too in your trunk. And then when you're picking up your arms, you're having that pain, you're not getting as high. And then you mentioned that when you're taking a deep breath in, it's kind of hurting, it's a little tight.
Yep.
So I'm gonna do a couple tests on comparing each side, as well as check out your ribs and your sternum, just to make sure. I know you said you didn't hit them, but sometimes we can have a little issue with inflammation or it hurting. I'm just gonna do a little palpation just to feel around.
Yeah, that right side's tender.
Okay, how about down here, lower?
No, lower feels good.
Good? Okay. I can tell you're a little tight.
Yeah, that right side feels a lot tighter when you press in, but the left side doesn't feel nearly as
Yeah. I can tell it's a
tense.
little sore, but it's not nearly as bad as the right side.
Yeah.
Okay. Now, all right, so first thing I'm gonna have you do is I'm just gonna have my hands on your side here, and I'm just gonna have you take some deep breaths. And I'm just gonna push in a little bit, okay?
All right.
So let me know. Can I have you reach with this hand over here to this shoulder? All right, can you take a deep breath in? How'd that feel?
Didn't hurt so bad because you're kind of pressing into that side.
Okay. What about over here? Have you switch arms? And in?
Yeah, that hurts on this side, but
Okay, okay. So what I'm doing here is I'm applying a little pressure, making that right lung fill up a little more,
okay.
to see how it is how it's feeling. All right, so I'm glad that you're not having some extension issues. I noticed that you said that laying in bed would feel a little better
Yep.
when you're laying there on your back on the hard surface. So the first thing I'll have you do is we'll just get you in that position. So I can have you lay on your back.
Yep.
All right, I'm just gonna apply a little pressure along your chest, okay?
Okay.
Sore?
A little bit, yeah. I can feel that right in here, and
Right
again,
on that side.
this is more, the front is more tight, and the back is where mainly the pain is, but
Okay,
a little bit of pain up here too.
okay. How's this area over here?
That's
Pretty-
tight, yeah,
pretty
but
tight.
yeah, that hurts a little bit.
Okay. And on this side,
Not bad,
not bad?
no.
Okay. I'm gonna put a little more pressure. Let me know if it's uncomfortable.
Yeah, I can feel that pain.
That same pain?
Yep.
Okay.
It gets a little bit worse when you press down on this bone.
Okay. All right. Can I have you sit up and then flip over and lay on your stomach?
Yep.
Up a little bit. All right, so what I'm doing here, I'm just working my way down. Got your lower cervical, your C7, that's your last vertebrae, and then we're bumping down a little bit to your T1, T2. A little more upper thoracic is what I'm thinking is causing the issue.
Yeah, where your hands are, that's where
Right
I
here?
feel it, yep.
Okay, so I'm on the side of your vertebrae over by the transverse process, which is like what goes over and then your rib connects to it.
Okay.
So how's
Yeah,
that?
that's pretty tender.
That's tender right there?
Mhm.
Okay,
The left side doesn't feel so bad.
okay. I'll do more. So I'm stabilizing on your side. Are you pushing on your side? Okay, let me know if it's causing issues.
Oh yeah, that right side.
Right, it's hurting.
Yep.
Okay, how about the other side?
Nope, that left side doesn't hurt.
Okay, that's good. All right, I'll have you sit up for me.
Alright.
Have you had any pain with coughing or sneezing or anything along those lines?
Now that you mention it, yeah, but when it's more like when I take the deeper breaths. Usually I have noticed though when I am taking the deeper breaths after like walking up the stairs or something, that when I breathe out, it seems to feel better. It's the big breaths in that really hurts.
Okay, so what I'm thinking is, I'm not thinking this is more of a chronic issue. You're in good shape, you seem pretty healthy, and you don't have a hard labor job, anything along those lines. And I'm not thinking it's a facet issue just because you're extending and you're fine. I'm thinking it's more of where your rib and your vertebrae are more meeting, your costrovertebral. I'm thinking that's more of they call it a dysfunction. But that can generally come on in a couple days after an injury and cause some issues, cause some pain with kind of what you're having with the inhalation and the rotation. It's common to see that first and second rib being a little tender, especially when you're doing that right rotation and the limits that you're having. So moving forward, we'll get some exercises for you to help strengthen, loosen you up a little bit, and then we'll do some hands-on work and get you going.
Okay,
Questions for
awesome.
me?
I just noticed that I feel like I feel like I'm just like sitting like this. Do you think if I work on maybe sitting more straight up, it would help?
I think that would help a lot. Yeah,
Okay.
we'll definitely work on your posture. We'll work on getting those up. I know it's a little painful right now, so once that calms down a little bit, we'll work on sitting up more. I know it's flexion that's causing most of your issues, but so if we're sitting up nice and tall, cue you right with that here, sit up nice and tall.
Yeah, that actually doesn't hurt. Just kind of.
That's good. Okay. So that's definitely something we'll be working on, and then being able to take those deep breaths, and we'll try to decrease that pain and play it by ear on how it goes forward.
Awesome.
All right. Thank you.
All right, thank you.